Hello and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. The shortage of nurses has been flagged multiple times over the years as requiring urgent attention from policymakers. Now, the demand for skilled nursing professionals continue to outpace supply, resulting in overburdened healthcare facilities, stretched resources, and compromised patient care. So, over the next half an hour on the show, we will explore the dynamics of the nursing shortage and the potential strategies to mitigate its impact on both patients and healthcare professionals. Joining me now is Puan Siti Mahfudz, who is a retired nurse manager. During her career, she was awarded Tokoh Jururawat Perkhidmatan in 2017, and she has served previously as the Secretary for the Malaysian Nurses Association. Puan Siti, thank you so much for joining me on the show. I appreciate your time. This issue is not a new one. Unfortunately, it's one that's been plaguing our healthcare system for a while. What do you think are the root causes of the shortage of nurses in Malaysia?
Thank you, Melisa. Good afternoon, everyone. Through my experience and through what I have gathered from friends, that actually the shortage of nurses is because either due to the workload, which they actually get stressed out due to they get burnt out actually through all this working shift duties and everything. And also most of the nurses suffered, actually we realized that nurses are suffering from muscular skeletal diseases and also backaches. So that actually make them retire early, or they go to other places which has less workload. And of course, we talk about the wages later. So those are some of the facts that actually why we are shortage of nurses, because nurses are draining out either to other places or because of the workload itself.
Can you give me an example of the workload? I understand that the workload because of COVID has increased, but also because of the shortage. So it puts more pressure on the nurses who are still in the system. Can you give me an example of the kind of immense pressure that the nurses face in terms of workload?
Yeah. Okay. Now we go into post-COVID. All right. Yeah, these nurses has been working hard through COVID. But the trauma that they had, no one understood. Even the policymakers, I don't think they understood. They give them recognition. Okay lah, they give some form of recognition. But in the long run, they are suffering from so many things because of the trauma. Some of them stress, and then they still think of what had happened before. But no one has actually give them support or give them courses or seminars to make them get back to their old person, which is already it changes because of the COVID completely. So what we need is actually a support, a continuous support for these people who has worked so hard in the nursing field during the COVID. Yeah, and also due to COVID as well, maybe some of the husband lost their job, so they have to get out from the job itself to help the husband to retire early, to get gratuity. When they get the gratuity money can help the family either to continue their life with that money. So I think that is also one of the reasons why the nurses are moving out from the hospital, from working. Yeah.
Okay. You mentioned wages a little bit earlier. How much does that impact or is part of the consideration for nurses in leaving the talent pipeline?
Yeah, okay. I think everyone will think money is the most important thing. Nurses think the same way, all right? So they work, they have to work shift duties, morning, afternoon, night, and the stress of the work that they are doing, the patient's demands and everything does not actually coincide with the wages that they're getting. And they have not been revising the wages for years. We have been stagnant in that. I think the last time the review was 19 no yeah in the 90s.
Wow.
So I think that should be something that we should consider about the nurses' wages. And also, most of the nurses are now going into degrees, going into specialization. And these people should be recognized and get a better wages because they studied. But no, they are still the same as the diploma nurses. So, all right. And also, one more is those nurses, they only have to move up a step higher when they are what do you call that? The service is 15 years, and they call it U32. Okay, that's a step after staff nurse. Then after 10 years, then you get into U36, which is very, very long for them to move up. Yeah. I mean, that's also something that the policymakers has to actually think about why these people are moving away.
So there's no clear career progression pathway for nurses. I understand. Can you help me understand? Because so where do our supply of nurses come from? Do we have enough supply of nurses? Are we training enough? Are we anticipating the fact that so many nurses are leaving the workforce?
Yeah. Well, again, wages. You know, there are many agencies outside who actually offering them lucrative pay outside the country. All right, especially in Saudi Arabia, they are paid like, well, there's a lot of money lah. You know, when you talk about pay wages. So these people slowly are moving in groups. Sometimes they go in groups to move into a better place. Even though we are training nurses every year from all over school of nursing around the country, but still we have not enough. As you see, people come in and people go out. You see, the people who are coming in and there are more people going out of the service. So that is why we are still shortage of nurses, and that causes more burden on the nurses and cause stress to the nurses as well. And that is caused the early retirement of the nurses. So those are the contributing factors that actually, make them run away from.
Right. Do you think it's easier to retain the talent from leaving, to keep them within the system for longer to help alleviate? Or is it easier to bring in new talent, train new nurses? I also heard there was a proposal to bring in nurses from other countries, so foreign nurses to work within our system. What do you make of all these types of solutions to address the nursing shortage?
All right. This is another market destroying factor, because these nurses from outside are paid less. So the hospital will take them because they are taking how much they're giving, not really. But our nurses has been working here, and the pay is still the same with what people are coming in who are much junior, because they accept whatever we are giving. And we have nurses from Philippines, from India, from Indonesia. Indonesia, I think not much, but mostly it's Philippines and India. So they are working mostly in a not in public hospital. I'm thinking that our nurses, okay, our nurses are still the best. Our nurses, Malaysian nurses, being a Malaysian nurse is okay. Malaysia. So anywhere we go in the world, people will always say that Malaysian nurses are the best. This is a fact. Melisa, you can check it out. It's true.
Clearly, if other countries,
we don't want them to come out from here because they are the best nurses. We want their service. So if the policymakers can make them happy and let them stay and work here, then why not? Instead of taking people from outside.
Right. What would you like policymakers to address regarding the nursing shortage? What would you like them to prioritize when it comes to the welfare of nurses, of keeping the nurses within the Malaysian healthcare system?
You're right. Of course, firstly, wages lah. So firstly, of course, please review the wages of the nurses, please, and let them enjoy as what is their specialties. If they have degree, okay, give them the way they want what is due to them, or other specialties. I think that is the most important thing. First, secondly, I think of course you have to have your service or your steps of naik pangkat lah, so that they feel good after 10 years. Oh, I got this. And there's an improvement in their service. I think that also will make them happy and they will stay back.
Okay, so can I also ask you, the fact that we've been hearing about overcrowded emergency departments because of the shortage of nurses, based on your observations and the things that you are hearing, how might have the shortage of nurses affected patient outcomes, the quality of service that's provided to patients?
Yeah, I agree that actually when the influx of nurses, of patients in ED or in the wards, and they're short of nurses, probably your quality definitely will drop, because you are supposed to give the best service to the patients. But at that situation, when there's so many of them coming in, you give your best, but it won't be as best quality as when you have more nurses to have around. So yeah, and that also called burnout to the nurses with that kind of influx of patients.
All right. Well, thank you for highlighting the challenges that our nurses are facing. I think there's a lot of talk about unsung heroes and appreciating our nurses, but I think we need to put our money where our mouth is and really show that increase the job satisfaction and the work conditions for our nurses. Puan Siti Mahfudz, thank you so much for joining me on the show today. That was retired nurse manager Puan Siti Mahfudz. We're going to take a very quick break here and consider this. We'll be back with more on this topic. Stay tuned. We'll be right back. Hi, welcome back to Consider This. I'm Melisa Idris. Let's continue our exploration of the dynamics of the current nursing shortage and the potential strategies to mitigate its impact on patients, healthcare professionals and healthcare providers. Joining me now is Datuk Dr. Kuljit Singh. He's president of the Association of Private Hospitals Malaysia. Dr. Kuljit, we've been hearing reports of a shortage of nurses for quite a while now in the private sector. Can you share what the situation is like? An overview of the current situation, Dr. Kuljit.
Okay, thank you, Melisa. Currently, private hospitals and including public hospitals, there is a huge shortage of nurses, and the reason being is that there's an increased surge of patients, and we will have to actually increase our capacity, particularly in the private hospitals. Now, to get nurses in Malaysia can be a challenge because many of our nurses do migrate or get jobs elsewhere, namely Singapore, Middle East, and even Australia, for that matter. So we don't have enough nurses, good nurses locally trained. The good ones sometimes are given better options to work elsewhere. So we are trying our best with what we have, and what we have is actually not sufficient. And we have patients waiting in our hospital 6 to 8 hours at times because we cannot provide them a bed, because to increase beds in the private hospital, you need to have nurses. There is a ratio that you need to make up before you can have more beds opened up in a private hospital.
Sorry, could you elaborate on that? So why, help me understand why the shortage of nurses leads to longer wait times for patients?
Because we need to open up more wards, and we can accommodate more patients provided we have more bed space. Now, the Health Facility Act in Malaysia dictates very clearly that you need to have a certain number of nurses before you can open up beds. You cannot just open up beds and you don't have nursing. There is a ratio that we need to fulfill. So because of that, the beds are sometimes full. We are waiting for the patients to be discharged. So you end up having patients waiting for beds to be cleared. And I think the similar problem you also have in the public sector. Sometimes patients wait not for a few hours. I was told sometimes they wait for a few days.
So the beds are there. It's just a matter of making sure that there are enough nurses to complete that ratio under the law. Is that right? Okay. Dr. Kuljit, when did you start noticing that this had become an issue, that this was in fact impacting the delivery of healthcare?
Okay, there was already a little bit of impact before the pandemic. But after the pandemic, middle of last year, we suddenly realized that the surge of patients coming back to the private hospitals increased in many folds, because they couldn't get themselves treated during the pandemic, and now they're coming back with conditions which became more chronic, more severe, and they needed treatment. They are non-COVID patients. So we realized that these patients actually required procedures, surgeries, and they all have means to pay to be in a private hospital. But then we do not have the capacity to take them in immediately because we don't have nurses. So we have urged the government to allow us to get in more patients, more nurses, if possible, from overseas in the interim period to cover the gap that we have. We know the nursing schools in Malaysia are trying their best to increase the number of graduates. But in the interim period, we need not just be post-basic nurses, specialized nurses, which they allow, but we want normal trained nurses to help us out, at least in the next 2 to 3 years.
Okay, so walk me through this. So, private hospitals have urged the Ministry of Health to liberalize the nursing labor market, bringing in foreign nurses, as you said, to kind of be a stopgap measure for the staffing shortage. What is stopping private hospitals from doing that currently? Are there regulations and guidelines that make it difficult for you to bring in foreign nurses?
Yeah, so like any foreign experts that you bring to the country, there are certain criteria you need to fulfill. You need to fulfill the criteria to show that you don't have enough of local talent, local nurses, which we have proven that we don't have. And number two, there is a process of taking someone from outside Malaysia. You need to prove that you have advertised sufficiently enough to show that there's not enough of local talent. We have asked this 1 year ago in the last Association of Private Hospitals conference, and the then Deputy Minister had promised that they will help us to see how they can move into this. So we are really hoping that this year, as things are getting better, we can be given this leeway, at least for 2 to 3 years. We're not asking this for a long-term thing. It's just to fill up the gaps as we are speaking.
But even if it is a short-term policy as a stopgap measure, do you foresee any unintended consequences of bringing in foreign nurses in terms of pay scale, in terms of accreditation, even if they are staff nurses, as you say, general nurses? Do you foresee there being challenges in any unforeseen circumstances of bringing in foreign nurses?
I don't see a major issue because we have done this before. This is not the first time. Many years ago, as about maybe 7, 8 years ago, we had foreign nurses in private hospitals, but it was stopped, basically to fulfill the criteria of using local trained nurses, which we were perfectly fine with that. And we did have enough local trained nurses at that point of time. But over the period of time, these local trained nurses became good. We made them very good. And now they have become marketable in other parts of the world. So we are back again to square one, that we don't have our own nurses. Our nurses, which is a good thing, our nurses are well recommended and well trained for the foreign market. So they easily get jobs in Middle East, in Singapore and Australia, and we are left with lesser workforce.
Is there any way to stem the outflow of our talent to other countries? Can we compete in terms of job satisfaction, in terms of pay, in terms of a career pathway to keep them here in the Malaysian healthcare system?
Well, I think we cannot compete with what is being paid to our nurses overseas. They are paid in many folds more because our nurses in Malaysia are very competent, and most countries would rather have a Malaysian nurse than any other country. So they are always paid well, and there's no way we can compete with the amount that they pay in the other countries. So we are happy that our nurses are getting paid well in a foreign land, and I don't think we want to stop that. But having said that, there are a lot of foreign nurses who are willing to come to Malaysia to work, and they're equally good. And they have their own reasons why they choose Malaysia as a place to work. And I think we should not stop them because they will actually help us for the next 2 to 3 years until we get back more workforces, more nursing force for our country. That's all we are asking, just a short-term gap.
Okay, well, in terms of a long-term solution then, I understand that's the request for the short term, but for the long term, can we look at how to address this issue more sustainably? Where are the opportunities to fix the system now, to anticipate the problem for the future? Are private hospitals looking at increasing collaboration with training, with private nursing schools, or in-house training your own, or setting up your own academy to train nurses? Is that something that's on the table for private hospitals?
Yeah, I think the important thing is most of the nursing schools have told us that, after the pandemic, there was a little bit of slowdown in their intakes. And I think they are also ramping up, but it takes time to train a nurse. Nothing less than 3 years to train a nurse. So I think they all are ramping up. And of course, we also understand that many of our youths sometimes are not too keen to take up nursing. So there's a little bit of a lack of interest, and I hope over the period of time, more will take up this job challenge of becoming a nurse. But I think that is pretty global because we find that even in other parts of the world, the younger generation sometimes look at other kind of jobs. But definitely, when the time comes when you really need something to do, I think more youths will take up the job. So we hope that this collaboration with the nursing school is not an issue. They are there, they are ready to train youths, and I hope more youths will be dedicated enough to take up this job. And of course, it is a lucrative job. As you clearly can see that, you can get a good job overseas in due time. We can't stop that, but at least help us for the time being.
Just a quick question about where the supply of nurses are coming from. So, as I understand it, there are about 2 dozen or so private nursing schools in the country. And what about the public sector? Is there cross-pollination when it comes to training nurses of the public sector and the private sector, or is it two separate streams completely?
Well, there are multiple nursing schools in Malaysia. The government has got own set of nursing schools, and we also have privately set up nursing schools. The standards are equally the same because they're all accredited by the government. But normally we try not to pinch nurses from the government sector because one, they will be bonded, and number two, it is up to the government nurses if they want to switch and come over to the private. But looking at the training, it is actually across the board because a lot of privately trained nurses do work for the government also. So it is up to the nurse where they would like to work. As far as salary is concerned, we are more or less the same between the public and private. And sometimes if you're well trained, maybe private may pay you a little bit better. But it's not our intention to paralyze the government service by taking away the nurses, because we are also very concerned that they need nurses for their care. But in that concern, I think the government should also look after us in the sense that we should also have some sort of leeway so that we can run our services and in turn help those Malaysians who are seeking private healthcare and make it seamless for us. So I think we have to just work it out together and without hampering one system or another.
Right. Datuk Dr. Kuljit Singh from the Association of Private Hospitals Malaysia, wrapping up this episode of Consider This. I'm Melisa Idris, signing off for the evening. Thank you so much for watching and good night.